My name is Jocelyn Ivie. I'm learners for NF2. My ID number is 392959. There we go. There's my partner who's taking the video today. And here's my kitchen counter where I'm taking the video in my surroundings. Hi, Mrs. Smith. How are you? She's okay. I have to hand hygiene. 30 seconds. Grab. Let's get dry. I have to read my scenario. You are the practical nurse learner caring for Mrs. Shirley Smith. 10 days ago, she presented to the emergency department stating that she was experiencing severe upper right quadrant abdominal pain. She underwent an emergency open cholecystectomy and then was admitted to the gastrointestinal surgical unit. She developed an infection and therefore had a prolonged hospital stay. Today, she will be going home once you remove her staple. The doctor's order: remove all staples, apply Steri-Strip, and cover with sterile dressing. That's my scenario. Doctor's order. That's the back. Policies check prior to this intervention. Hi, Mrs. Smith. Can you tell me your name and your date of birth? And do you have any allergy? Latex allergy? She said no. You have to compare. For some patients, they don't talk, so I don't need it. I need to do this. Shirley Smith, hospital number 125-2569, 125-2569. Date of birth is March 27, 1985, March 27, 1985. Room number is BBC 352, room number is BBC 352. Physician is Dr. Gregory Spark, Dr. Gregory Spark. I have to make sure that the bed is in my waist, level working condition, everything below the waist is contaminated, so I have to raise the bed. I have to check my tray, checking for integrity. This was open because I've been practicing. I can tell you the expiry date. There's no expiry date here. It's just the same with my stapler. It's open because I've been practicing. But you can't use this if it's in real person. I can use it because I'm practicing with a mannequin. Expiry date is November 6, 2023. Here's my sterile strip. Expiry date is 2025. And my extra 2x2 balls. And have my normal saline, prescribed for Shirley Smith. Expiry date is June 6, 2022. 0.9 sodium chloride. And this was open, so this is good only for 24 hours. I have the tape. I have my gloves and sanitizer in my cabinet. I have to have hygiene. Hi, Mrs. Smith, do you need a pain medication before taking your staples? She said no. She said she's okay. Oh, how are you? Not exposing her too much, so I'll just do that. I have to tear it slowly. I don't want to kind of create skin tear. And I have to count the staple if all staples are here. Yeah, I have all the staples. And I have to assist for Rita. There's no redness, there's no edema, there's no bruising in the drainage. There's no drainage, so I can't assist for taco, but if there's drainage, I will tell you the type, amount, color, and odor. And for approximation, it's well approximated and intact. I can just crunch this one, go with my gloves. I have my garbage can here, throw it in the garbage. Hand hygiene, 30 seconds. Now I have to grab I'm making sure not to grab my tray on top to avoid contamination. Checking the integrity. As previously stated, it was open because I've been practicing. I can open it towards me or away from me. Make sure not to touch the top because now I'm not touching the top. I have to grab my low forceps. I'm not using the first one. I'll just put it here. Mrs. Smith, can I put this beside you? She said yes. Can take this one. 2.5 is considered contaminated. Oops. So I'm making sure I won't exceed 2.5. Sunny side down. Grab my garbage. Miss Smith, can I put my garbage here for now? It's okay if I can put my stuff? She said yes. Making sure not to touch. My hands is up, making sure that below my waist. 2.5 is considered contaminated, so there it goes. You know what? I touched the covering, but it's okay because I did not touch that. The covering is not going in, so drop it there. 2.5, making sure not to touch the tip, which is not touching my drape. Now I have to set up my garbage. Here, I have to grab my normal. Okay, still have to compare. Shirley Smith, expiry date is June 6, 2021. And again, this was open, so it's just good for 24 hours. Normal saline, 0.9 sodium chloride. I have to put it here so it's easy for me to see. And remember, palm is on the label. This is my second check. I already did my first check when I'm checking all my stuff. And I have to pour it not too high to avoid splashing and not too low to create, to touch the tip. Here. And I have to check again for my third check. Shirley Smith, expiry date, it's good. I just try to navigate my tree. I'm not touching the tip. I'm just touching the bottom. Then use your hand hygiene. Smith, you might kinda feel this might kinda painful if I'll remove your staple. Have to grab my stuff. Make sure I'm not cross-contaminating. Oh, I kinda put it up, but it's not wet yet, so it's not contaminated. So, but if it's wet, I already contaminate. So, it's supposed to be down. If I down. Now I have to make the pillow. Pillow, down. Now my forceps is wet, so I can't put it up, because in the 7 principles of ASIF says about gravity. Now I have to clean on the middle. Clean is the dirtiest, so the middle, one swipe, not to dab garbage. Second, pillow. Farthest. And I'm making sure, because my forceps only the sterile, I'm making sure I'm not grabbing too far. It's just the distal from me. Proximal from me. Garbage. Now I have to let it air dry. In this one now, although it's just one of my forceps is wet, but I think I don't need it because I have my blue forceps. Especially this one, this is wet, so I don't need my tray, so I can just put it here because they're going to the sharp. This one, I can just use it in case I need it. It's not wet, so now I'm letting it air dry. Now I have to grab my staple. Told you this is already open because I've been practicing it. Have to open like a banana. Here, in this one, I only have to touch this one, and I have to make, because the one going to the skin, I have to maintain the sterility. So there. Remember, the part that I've been touching is contaminated. So that one I have to maintain being sterile. And now, according to the doctor's order, I have to remove all staples. But on our aerobics, for the case of lab, I just have to remove 3 staples. But in real world, if they say remove all staples, you have to remove all. And here I have to just, I'm removing the stapler. I have to remove it from the second alternate. I'm not removing it from the first one or the end one, because that's the one is, it's anchor to prevent the wound to open. So I will avoid wound dehiscence. So here, pinch, wiggle, clip. Got it. Then I can just put it in the garbage right away, or 1, wiggle, 2, wiggle, 3. I can just put gauze here too to put my staples, but my garbage is closed, so I can just drop it. Now I'm done. Then I don't need the staples, so I can put it on my tray because I don't need the tray. Now I can just remove my gloves. Gloves to gloves, skin to skin. It's garbage, hand hygiene. been practicing. I don't need to use glove as long as I'm not touching the middle. That's the one kind of go to the wound. So I'll can avoid that using gloves too, because this one will stick to the gloves. So peel it from the top. Garbage. To peel it here. Garbage. Put it here. So still kind of 2.5. It's being sterile. I'm just touching the tip. I'm not touching the middle. It's already air dried, so put this here. Kind of like that. Grab the second one. I'm not touching the middle to maintain sterility. Second. Garbage. That's okay, I can put it. That's good. Garbage anyway now. Where I can use my blue forceps, but I put it kind of close to the edge now. So since this is not wet, I can use this one in case that's kind of contaminated. It's close to the edge to make it sure. Here, here. This is not wet, so I can just, the other one is wet. That's why I put it in my tray. Here. I'm almost done, Mrs. Smith. I don't know this anymore, so I'll put in my tray. I can put my here, one. I'm almost done, Mrs. Smith. 2, 3, 4. Now I have to wear gloves. And clean my stuff. We're wearing gloves now, but oh, I forgot to. I have to write initial this one, so the nurse know that the time that I changed. So I'm not writing on my patient. I have to write here the date, which is June 9, 2021 at 1900 GI. Here. I did not use my gloves somewhere else, so I still kind of clean. Here, I have to clean my working area now. This is going to the sharp container. It's going to the garbage. Now, remove my gloves. And Mrs. Smith, garbage, hand hygiene. Have to blanket my Mrs. Smith. Then I have to give my 3 teaching. Mrs. Smith, don't get your incision wet. And don't scratch it to avoid the incision to open. And don't grab stuff behind your head or kind of don't do lots of movement. Do you have any question? She said no. Do you need anything? She said no. Then I have to lower the bed. I have to, here's your call bell if you need anything. Thanks for your cooperation. I'll be back in 2 hours and check on you. Bye-bye.